Welcome to Unscripted with IMF.
This is the podcast that covers leadership, relevant hot topics, encouragement, stories, and the future of the church.
This is a space for ministry leaders to learn how to ignite change and inspire growth wherever you serve, because IMF exists to serve those who serve others.
Now let's get into today's episode of Unscripted with IMF.
All right. Well, hey, IMF family. I'm here with my friend Eric Hall, and today is going to be an exciting time for you as we dive into chaplaincy ministry. And just to give you a little bit of background here, Eric is president and CEO of Healthcare Chaplaincy Network and the Spiritual Care Association and the chancellor of Capstone University. And he has done an amazing job of bringing chaplaincy to the forefront. Now, what oftentimes we realize or understand in chaplaincy is that things just work, or, oh, we have accreditation, or we have this, or we were able to go into hospitals. Well, there's always a catalyst behind what enables us to do that. And I want you to know that Eric is that catalyst. You've helped chaplaincy bring it from just something that goes on the sidelines to now being recognized as, and not just chaplaincy, but the spiritual health of an individual, how that helps in their healing and can actually lower individuals' medical costs. And that's what insurance companies are interested in. But first, could you tell us the difference between the Healthcare Chaplaincy Network and the Spiritual Care Association?
So Healthcare Chaplaincy Network was the first organization that was established almost 60 years ago now. And that organization, put chaplains in hospitals, but additionally, they spent a significant amount of money around research. The research that they were interested in was exactly what is spiritual care? What is its impact on people? And what are the outcomes? What are the benefits of all of that? Because, at those days, 50, 60 years ago, you never really had to worry about spiritual care being an issue or providing spiritual care because most hospitals had a religious affiliation, most of the hospitals in the US.
Right.
So part of their mission statement, was really that, God was infused into, their care. But now as, conglomerates have come around, things have changed. There's really this question about outcomes and benefits. What exactly is it that chaplaincy brings to the forefront? What is it that we do? How do we infuse ourselves into this whole person care? What does the care for the human spirit look like? And really, what should we be getting for our investment in a chaplain? So Healthcare Chaplaincy Network, having done all of that work, there was a transition of leadership. I came in 13 years ago. And really the direction of the board was, we have all of this, we've built all of this, we spent all this money doing this, but we don't see it impacting or changing anything in the country, So how do we do that? How do we make that happen? I just happen to have some background with Washington, D.C. and doing other agenda type items and advocacy. And so, we went to work trying to put together the research to validate and support spiritual care, and thereby then moving forward to advocate for infusion of spiritual care in specifically healthcare.
Okay, and so that's how you got the Spiritual Care Association.
Correct. So it was actually an outgrowth. So once we created once we had Healthcare Chaplaincy Network and we did the documents, we realized that it would be really important and fundamental to make sure that every chaplain was trained the same. We don't have consistency in our field. And so everyone, depending on whether or not you had good supervisors or whatever the case might be, is really indicative of exactly what level of competent clinical care you could provide. And so we realized that it did come down to knowledge, how much a chaplain knew, and that should be universal. And then additionally, it had to do with clinical competency, the actual encounter, with an individual. When we created this curriculum, we went to give it to other organizations and they didn't want it. They thought that we were too strongly evidence-based, and yet at the same time, we would argue that it should be the evidence that leads us, because the evidence is so overwhelming that what we do is vital, is necessary, is important, and does make a huge difference and contributes on all different levels. And so the Spiritual Care Association happened really in spite of itself. It just sort of, we were like, okay, then let's do this ourselves. And so we started with a curriculum. We partnered with ICPT to do CPE. We offered it, by the way, everything we do, we offer to all the agencies, all the accrediting agencies. We talk to everybody. We try. Some people want to talk to us. Some people don't like us. I don't know what that is. But anyway, we offered it to everybody. ICPT happened to be the CPE provider that came up and said, look, we're very interested. We'll infuse it in our education. We do think standardization would go a long way. And so we started with that, and then we built our own board certification process.
Right.
And here we are.
So people don't know what ICPT is.
Yeah, so it's a clinical pastoral training. It's the group that provides clinical pastoral education. So clinical pastoral education is really the hallmark of chaplaincy. Most chaplains come to chaplaincy with, probably a master's of divinity. Probably most of us are ordained or, in whatever our religions or traditions might be. And then a CPE would be this process by which people are learning and encountering at the same time. So they're learning from a supervisor and they're going out and they're working with individuals. And that type of interaction, that type of on-the-ground training type model is really fundamental and foundational to what chaplains has been.
Okay, so let me just back up for a second. So in the 50s and 60s and maybe even the early 70s,
Right.
hospitals were mostly founded on Christian values. And
Well, not just Christian, right? So, Jewish hospitals in New York City, right? And
so they had a spiritual side to them.
it was fundamental. It was part of, if you walk into most of these old hospitals, you'll see a quote from scripture,
Right.
Over the entranceway that has been there, since its founding.
Right. And then it shifted. And then chaplains were the hospitals realized that people needed spiritual care, whatever background. I mean, we're evangelicals, but whatever background, whether it's Jewish, Muslim, whatever, that people needed spiritual care. And now they're recognizing that not only is it a basic human need for spiritual care, but there's a financial side, which is why insurance companies care about it. Tell us what you did when you went to Washington, D.C. to lobby on behalf of the Spiritual Care Association.
So, one of the first works that Healthcare Chaplaincy and the Spiritual Care Association did was we started putting together these foundation papers. Sometimes they're called white papers. The white papers really are a really cosmic, very focused glimpse at what is the heart and soul of an issue. So they're not meant to be verbose. They're meant to capture the core principles, and then, as with any good foundation white paper, it's about having the validation and the references. So one of the first documents we did, what is spiritual care, why is it important in healthcare? It's a 20-page document, but it has 93, 94 citations to it. And those citations, it's not from some meditative study group someplace. You're talking Cleveland Clinic, Sloan Kettering, big hospitals in our system that have been focused on this and have done this work because they themselves have seen it. What has never happened was this information was never all culled together, was never pulled together, and a proposition, validated by all of this evidence. And so our proposition, our value statement was that chaplaincy, fundamentally, the provision of spiritual care, is beneficial, provides outcomes, benefits, and cost savings to an individual who receives spiritual care, along with the regular care that a hospital would provide. And in that, I mean, the doctor, the nurse, the social worker, and of course, we would hold, as the World Health Organization also posits, that chaplains are the key team player for spiritual care. It's not to say that nurses, social workers, and doctors should not know about it. For instance, we take for granted all the time. You go into a room and people say, oh God, what have I done, to deserve this, right? And a lot of us, we dismiss that. But the truth of the matter is, if you could train an interdisciplinary team to listen for cues, a lot of times patients will tell you things that are happening inside of them that is deeper, right? And so we believe that, the team is fundamentally important. So when we put together this value statement and did this white paper, we started looking around, okay, it was important to start the education, but how do we change society's image of this? Because since most hospitals are not owned by religious organizations anymore, it really does come down to bottom lines. Chaplains have never been trained. We don't know anything about how to argue for ourselves.
Right.
We don't know how to bring documentation that validates what we do. We don't even sometimes really understand what the administrator wants to hear from us. So we started this national move by going into Washington, D.C. and starting conversations with Medicare and Medicaid. And Medicare and Medicaid, because fundamentally they are the largest provider and payer of healthcare in our country. So everyone in some way, shape, or form, all of us will get to the point where Medicaid, Medicare will be part of our care process. So when we were strategically looking, we were like, okay, how do we do this? Now, the VA already has, the Veterans Administration already has codes and the like, and the military has always held value in spiritual care. They've
So
gotten
the
that.
codes are important to receive payment for hospitals.
So right now where
Is that
we are
correct?
is, yeah, so the argument that we made to CMS that they agreed with, it wasn't really an argument. They were really they wanted to see the evidence is the fact of the matter. It just comes down to that. They want to see what is it that you do, what is the outcomes, what are the benefits. Once we were able to show them, it took a while. It took years of education, conversations and the like, but in the end, they gave us 3 codes. The first code was for to provide a spiritual assessment. The second code was for a one-on-one intervention. And then the third one was for a group dynamic. So if you're there and you're talking to the individual, the patient and their family, that would be considered that. Now, we started the conversation, we showed them all that. They finally said, look, we'll give you these 3 codes. There's no reimbursement at this time for any of that. However, this is where it is. One is, without having a CMS code, there would be no chance at all of reimbursement, because unless chaplains are recognized as a profession, that's what these codes really do. It's fundamental, right? They raise our profile to the fact that we're an actual profession with as much validation behind us as a doctor, as a nurse, as a social worker.
So what you're saying is a radiologist has a code,
Yes,
an anesthesiologist has a code.
Yes.
A nurse has a code for every service they provide.
Correct.
Is a code, because
Correct.
that's how Medicare and Medicaid interpret it. They just see a list of numbers.
they recognize
which
them as a
don't correspond
profession.
with the services that were
Correct.
provided. And prior to this, there was no chaplaincy
No codes.
code. So even though chaplains were there doing work and helping families, there was no formal recognition for it.
Right, correct.
At IMF, we know the importance of collaboration and believe that by joining in partnership, we can achieve greater impact. Our partnerships are in place to open doors, enrich educational and professional opportunities, and provide discounted resources for our IMF members. That's imfserves.org/strategic partnerships.
So right now, CMS doesn't know what we do. We're part of a hospital system, but there's no way of tracking that. And so everyone's got their own way. Codes now allow chaplains nationwide to be able to show what they do and put down. So every encounter, everything, all the numbers count, all the quality of that encounters count. And so we'll have the opportunity to go back to CMS and say, look, maybe there's a possibility for a small reimbursement amount, or if CMS is moving in this direction, which it seems they are, they just did this with palliative care. Palliative care has one reimbursement amount for all the services that are provided during palliative care. I think CMS will continue doing more of that. If we could get ourselves included in those things, then I think chaplaincy, this raises our vision. It raises people's understanding of what we do, gives us validation as a profession, right? As vocation, people doing this. But also now there's this possibility that we can actually become infused and properly compensated and grow our profession. because hospitals will need more of us to meet the needs in
Right.
order to get reimbursed.
Right, so it's kind of part of that magic triangle in a community. You've got business,
Mhm,
you've got government, and then
Mm.
you've got the nonprofit sector.
mhm, Yeah,
And so for years, chaplains have always kind of ran out of other churches and ministries as a volunteer capacity.
correct.
But now that less people go to church
Mhm,
and the chaplaincy care has actually skyrocketed from what I'm reading,
mhm,
is because people are so interested in spiritual matters, not
Yes.
necessarily Christian, but spiritual matters. They
Mhm.
realize
Yes,
they want someone to not just give them a shot, but to look them in the eye,
yes.
to give them a touch, to say, you matter, you're an important person, to help bring families together. So that is absolutely essential
Yeah.
and vital.
All of us, John, have things that bring us meaning and purpose. All of us.
Right.
Chaplains are really challenged to walk side by side, not to lead, to walk side by side, and to allow and to reflect back to the person those values and those things that bring them meaning and purpose, so that that becomes part of their healing process or transition process.
So let me ask you, so say for example, a lot of our listeners are gonna be, they're already chaplains.
Mhm.
Some are looking into chaplaincy,
Mhm.
that's my second question. But they're already chaplains, what would you say to them if they're already a chaplain volunteering or serving in some way, shape, or form? How could they take their calling to the next
Mhm.
level?
Well, listen, if you're already a chaplain and if you're already in a hospital, I had a conversation with a woman from the Mayo Clinic just now. Make sure your administration knows that there are these codes available. We have already done mailings to hospitals and to chaplaincy departments all across the country. Every single one received one. But it is important for administrators to sort of understand and to recognize that these codes are available, that it is a way for them now to be tracking what it is that a chaplain does and the values that they bring. We're also now able to, put notes into medical records because of the fact that we have the codes. So I would ask all of us, to take this very seriously, because what happens next as a profession for us, whether or not we become reimbursed or bundled into payment models, really will depend on how we handle this now. Getting the codes may have been the easiest part. Implementing them across the country and pulling together the data that validates, that we belong at the table and that we should be compensated for what it is that we do, is important, because as there are so many social workers in a hospital,
Right.
because they do what they do and they get compensated for what they do, that is going to be the driving factor to the growth of chaplaincy in our country. And also, for the record, as Medicare, Medicaid goes, other health payers also go as well. Empire and all those other Blue Cross, Blue Shield, all of those guys will follow along with a reimbursement model based on what CMS does. The other big concern I have, John, is, we got these by the grace of God with enormous amount of work and investment. However, if we do not deliver, CMS will remove the codes and they will never come back, because the one time we had as a community, and this is where all of our boundaries have to drop. Doesn't matter if we're one group or another group or this religion or another. This is the one thing that we all hold in common. And I really do believe if we don't do this well, if we don't rise to this occasion, if we don't understand that what's happening now might not be so much about us, we might not get the full benefit of it, but the next generation will.
Right.
And that's what is in all of our hands now. What happens next for the next generation? And more importantly, let's just bear it all down, because this is where we all are, right? From this as a vocation perspective. What happens to patients and their families and to staff in hospitals if we're not there?
Right.
What happens?
Right.
And for us, it is about caring. And so this is simply a model, an opportunity to grow in a significant way, all across the country, to have more and more chaplains.
So would you recommend someone who's in it right now take some CPE courses?
Oh, for
clinical
sure.
Pastoral education, I
Yeah.
mean, do you see that's where the industry's going? So eventually they're gonna standardize it and say,
Yes.
you must have 5 CPE.
Yeah,
units?
it's gonna come down to board certification. They're gonna want board certification. Now, understand, you know, Medicare, Medicaid, when they hear board certification, what they think about is a cardiologist, urologist, radiologist. They all go for board certifications. Those processes are very intensive. Not like some of the processes that we go through to become chaplains.
Mhm.
We're going to have to really take an honest look at ourselves and see, are we actually providing chaplains with enough education to fulfill these codes?
Right.
Do they know what a spiritual assessment is? Honestly, I would sit here and say 40-50% of our country's chaplains, they wouldn't know what a spiritual assessment is. That's
Mhm.
problematic because the first code is to provide a spiritual assessment.
Right.
So I think we have to, as a field now that we got this, it almost, drags us along instead of us pushing it. Drags us along because we have to meet a certain criteria.
So what does it mean? Just give us a quick show. What is a spiritual assessment? I mean, if that is now a code, I'm a chaplain.
Sure.
I'm like, I don't know how to do a spiritual assessment.
So-
Is there a standard
Yeah,
test? that
absolutely.
people
Yeah,
do?
there are, and there
Yeah.
are a number of them out there, but a couple of them have been validated. And in order to save everyone a lot of aggravation and trying to write this down and hear this, go to the Spiritual Care Association.
We will drop a link on this podcast.
The Spiritual Care Association will, there'll be a link on our homepage to take you specifically to a website that has been designed around the codes and fulfilling the obligations of the codes.
Good.
Because a spiritual assessment, CMS, Medicare, Medicaid understands a certain way. Interventions, they understand a certain way as well. So we have to follow their way of doing this, not the way perhaps that we've been trained. But also, again, we should be excited about the fact that we've been invited to the table. They understand that we could bring value. We would want to be at our best, right? Because being at our best means that the patient and the family and the staff get, the most benefit from having us around.
Mhm. So what if I'm new and going into chaplaincy? Like, this is something that, I mean, either I came out of the military or I've just got a heart for it. I've got a
Mhm.
pastor's heart, but
Sure.
I'm drawn to hospice care. I'm drawn
Mhm.
to some sort of assisted living in a chaplaincy role. How do I start kind of pursuing my career in that?
Yeah. So listen, clearly the Spiritual Care Association does board certifications. We'd be happy to walk with you through your journey. We would ask you to fill out an application. We would take a look at your background, your studies, all the work you've done, anything that you've, engaged in pastorally or otherwise. And then we would assess what it was that you would need. I could tell you right now, CPE, clinical pastoral education, is fundamental to that. So, you're talking at least 4 units of CPE, that you would need for that is what most people would be looking for. For us, honestly, SCA, we say 2. But our experience is that 4 is really what is required for people to have the most experience. And then, there is a testing process through us. And then there's also, this standardized patient exam process as well. And at the end of that, you would become board certified. And then there would be yearly or, every 2 or 3 year seasons where you would have to,
Right.
re-
So that does, just so our listeners know, that does make a big difference, especially going forward. It's that board certification is, especially as the chaplaincy is becoming more formalized.
Right.
And we really want to make sure that chaplains can get into hospitals, assisted living, in even schools, especially if it's a private school, if they have a chaplain or some sort of a spiritual care director. That is why this is important.
It is important. And also, let's just be honest with ourselves. My preparation for my ordination didn't involve much of, hospital care.
Right.
I remember when I was standing outside the door of my first family that I was going in and the individual was passing, I remember saying outside, dear God, don't let me mess this up, right? Because we didn't have,
Same prayer I said.
it's, please, we never went through anything. We
Right.
didn't go through any intensives that, because there's a whole bunch of emotion that you're bringing with you and there's
Right.
all this stuff and you're walking into a dark place and
Yes. Emotionally charged.
not necessarily prepared for any of that. And this is where CPE comes in. This is where training to be a chaplain is distinctive of being a pastor. There are unique situations that chaplains are in that might in some ways resemble, but in a lot of ways they're really very quite unique. So getting properly trained makes you better at what you do, takes away your fear and infuses courage.
Right. Again, we're going to drop some links in this podcast so you can find out where to go for more information, how to get in touch with Reverend Eric for sure, any of that information. But any final comments as we wrap up this podcast, any words of encouragement that you would have for our existing chaplains, any direction that you
listen,
want to point us in?
I would just underscore some things I've just shared with you. You know, these codes go a long way now to establishing the validity of spiritual care. We cannot minimize that. Up until now, we've been an appendage to care. Right now, they understand, Medicare, Medicaid understands that spiritual care has a value, makes an enormous contribution to the experience, the health experience that an individual is having. I think secondly, we should take pride in that. We should also learn about the data that validates what we do, because we shouldn't just be dependent on the fact that someone, thinks that we're valuable, therefore we are. No, we're a profession like any other profession, quote unquote, right? Most of us come to this with vocation, but that type of profession is standing really is important to us. We should take pride in that.
Right.
And also additionally, now is our time as a community to engage.
Mhm.
We as chaplains must do this collectively. Whether you're in the military, you have codes there, right? Whatever line of ministry that you might be in, this is our opportunity to come together and to collectively make this lift. And really, maybe not entirely for ourselves, but most vital for the next generation.
All right. Thank you very much.
Thanks, John.
Appreciate your
Thanks for
time and your
having me.
help. And listeners, this is important. It is so important to hear the message that Eric shared. He's a good friend of IMF, and we know that we want to keep you strong. We want to help you to do the best that you can in ministry. So follow the links, check it out. If you have any questions, you can reach out to Eric or myself. We would love to help you in your chaplaincy ministry, and we praise God for the direction that it is headed. It is no longer in limbo, but now we are being recognized, and it's due to Eric's team and other people who've worked so hard to make it a reality. So thank you. May the Lord bless you in your ministry.
Thank you for listening today. If you found value in this episode, be sure to subscribe and share it with others. Don't miss the next one. We release new episodes every first and third Thursday of the month. We serve those who serve others in frontline Christian ministry. So for more information, visit us at imfserves.org.